NHS England developed the Health Equality Partnerships programme to support systems in their collective effort to strengthen new and existing partnerships, further develop the skills and knowledge base of their new and emerging leaders, and provide practical support to underpin collaborative working around a shared goal.
There's a strong history of partnership working in Somerset, and particularly in relation to homelessness and rough sleeping. And following some work we did in probably 2018, we recognised there was a real gap around a nursing offer. The Health Equality Partnership Programme is an NHS-run programme with the intent really to bring people from various disciplines together to work on health inequality. So when we were able to apply for the Health Equalities Partnership Programme funding that the programme brought enabled us to pilot the nursing team. We've ended up with a situation where we've got a very small team really, a team of 8, who have developed relationships with accommodation providers, other health professionals, and they've almost become the glue that we're starting to build this homeless health offer around.
What I've found since working with the homeless nursing team is that rather than having me here for a few hours a week, we've got a lot more flexibility, we've got more people, we've got people with different skills, and we're able to provide a much fuller service.
It's much easier to sort of bring the services to an individual who's struggling to make appointments rather than expect them to sort of go to various parts of the local community.
A lot of the people who are homeless are actually extremely vulnerable. So the smallest thing we can do to just make it easier, it has a big effect on the outcome.
Core 20+5 aims to support the reduction of health inequalities among the most deprived populations and groups that experience poorer than average NHS access, experience and outcomes. It focuses on 5 areas of health inequality: maternity, severe mental illness, chronic respiratory diseases, early cancer detection, and finding people who have hypertension or high blood pressure.
One of the key features of this piece of work that we've been involved in is looking outside of our existing silos, working collaboratively. So this is the next phase of the evolution of the NHS, I think, where health and social care and complementary services start to become part of a system, and so that reflects the aspirations to the wider integrated care system that's going to happen in Somerset.
I'm a great advocate for people that aren't, accessing healthcare, people who don't sometimes feel they deserve that healthcare, which, really does upset me. So when people do actually get the care they need, doesn't matter who that's from, it doesn't have to be me. If I can help them engage with another service at the hospital, that's hugely rewarding, because I know without this team that possibly might not have happened.
From a scalability point of view, I think the work that we've done shows that at a relatively low cost, you can provide a really high quality offer to some very vulnerable people, but leaning on and working with existing services. And I think if you've got a non-urban county, but actually you've got a need spread across the county, I think it'd probably be quite worthwhile talking to us in Somerset.
It's really, really rewarding to see somebody who is able to make a huge difference to their lives with support from other people. So I don't think you can ask any better than that, really.
They're amazing people, and yeah, I can't thank them enough actually. I mean that, I really like to thank them from the bottom of my heart, because I wouldn't be here without these people.